Today we are going to talk about an important topic, endometriosis. Many could have heard about endometriosis, and especially people who are attending infertility clinic, they could have heard about endometriosis a lot. Because over the past 2 decades, the endometriosis incidence has increased a lot because of lifestyle modifications and because of increased imaging modalities which can diagnose it more better. So endometriosis is one among the most important cause of infertility, and it is a more hormone dependent tumor. Though it is not a cancer, it is a locally aggressive tumor which involves the neighboring structures, which needs medical treatment, and in few cases it needs surgical treatment. So what is endometriosis? So what usually happens in a normal menstrual cycle? In a normal menstruation, the ovary will grow follicle and will release a mature egg during ovulation, and simultaneously the uterus will prepare itself for implantation of the embryo if fertilization occurs during that cycle. That means the inner layer of uterus, which is the endometrium, will grow and make itself like a cushion-like bed. So when it and will be ready to receive the embryo when fertilization happens during that cycle. That is, pregnancy occurs during that cycle. If pregnancy does not happen during the menstrual cycle, the formed endometrium will shed during menstruation. So usually the menstrual blood along with the formed endometrium will shed during menstruation. So in the case of endometriosis, there will be retrograde flow of menstrual blood. The menstrual blood, apart from coming out through the vagina, will backflow and go through the fallopian tubes and will get deposited which are adjacent to the surrounding the uterus. In the pelvis, like the arrangement is like the uterus will be between the urinary bladder and the rectum. The urinary bladder will lie on the front of the uterus, and the rectum will be on the back side of the uterus. And we have ureter, which is tube-like structure which comes from kidney and joins the urinary bladder, which is in the front of uterus. So when the endometrial cells gets deposited around the uterus, they can infiltrate in the tissue wherever it has got deposited, over the ovary or over the pelvic peritoneum or the ligaments which is surrounding the uterus. They can get infiltrated there. So what happens in subsequent cycle? So when under the influence of ovarian hormones, the inner layer of uterus, that is the endometrium, will form and bleed during menstruation. The same, likewise, the endometrium which has got deposited around the uterus also will grow and bleed during menstruation. So in such cases, it can get adherent to the adjacent structures. They'll bleed, they'll get fibrous, there will be inflammatory, they'll release inflammatory cytokines. So all that will lead to adhesion with the uterus and the ovary. So the fertility will get compromised. The patient will have pain during menstruation. The patient can have painful intercourse. Patient can have chronic pelvic pain depending upon the severity of the disease. So the most important aspect of endometriosis is the treatment part of it. So when depending upon the age, parity, the desire for fertility and the severity of the disease, will go for the treatment. So we can either go for medical treatment or surgical treatment. In a mild form of disease, and if the ovarian cysts are very small and the disease severity is mild, the patient symptoms are less, then we can go with medical treatment. In such cases, we will be suppressing the menstruation. So the main theory behind endometriosis is retrograde flow of menstruation, so we'll be suppressing the menstruation. So what happens when the endometrium does not grow? The outside ectopic endometrium also won't grow, and the disease severity will come to a halt. So there won't be any progression of the disease. So in a patient with infertility, and if the disease is severe, in such cases we have to go for surgical treatment. When we are choosing surgical treatment, the first surgery is the best surgery for the patient. And worldwide, the most accepted mode of approach is laparoscopic or robotic approach. Because like in laparoscopic or robotic approach, we'll have a 8 to 10 times magnification of the field, and we'll have 360-degree rotation wherein we can see the neighboring structures clearly. and we can assess the extent of the disease. We can assess the severity of the disease, whether it is deeply infiltrating or if it is superficially involving. So everything we can be able to see with the laparoscope or robotic. And we can give a complete clearance also, so without damaging the vital structures. As I have told you, it can involve the ureter, it can involve the urinary bladder, or it can involve the rectum. So we have to give a good clearance. We have to completely excise the endometriotic deposits. Most importantly, we have to restore the normal pelvic anatomy. So when we can achieve a good clearance and we can restore the normal pelvic anatomy, we can improve the fertility chances. After a good endometriotic surgery, the chance of pregnancy is very high. So if the disease is not involving the fallopian tubes and if the ovarian reserve is normal, the patient can be advised to go for natural conception. They can try natural conception, and in most of the cases it will be successful. In case if the disease is more severe and if the ovarian follicle reserve has come down, and if it has involved the tubes, and if the tubes is not functional or if it is not patent, then we can advise the patient to go straight away for assisted reproductive techniques like IVF or ICSI, depending upon whether the male factor is normal or not. So they'll have a very high chance of pregnancy within 6 months to 1 year following the surgery. So they have to utilize that period properly. And after delivering the baby also, after they undergo treatment and after they conceive and deliver the baby, they actually have to come for follow-up to prevent the risk of recurrence. Retrograde menstruation, they'll have the risk of recurrence till they attain menopause. So they have to go for medical treatment or conservative treatment following the delivery till they attain menopause to prevent the risk of recurrence. And we have various medical treatments. Reliable option is to go for hormone releasing intrauterine device, that is levonorgestrel releasing intrauterine device, which will be placed inside the uterus once they complete their family, or else if they want to give a gap between the pregnancy, they can go for this option, and this to a great extent will prevent the risk of recurrence.